Now, as South Africa enjoys some reprieve from high coronavirus infections, cases are rising in Europe. Austria has become the first country to announce a lockdown that will only affect people who are not fully vaccinated. One of the rationales is to push up the vaccination rate. So what can we do in South Africa to encourage vaccination? Let's look at the data. Around 40% of South Africans have received a dose, maybe just one dose of a coronavirus vaccine, so the full vaccination rate could be much lower. And raising this rate is urgent. A new study has found that a higher proportion of black South Africans compared to other racial groups have been admitted to public health facilities for COVID-19. Let's discuss now. We're joined by the Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal. That's Professor Mosa Moshabela. Professor, thank you for being with us as always. Isn't it incredible how our problems have changed? We used to cry about a lack of vaccine doses in the country. Now the health department says it has enough to vaccinate all adults by December, but the people just aren't coming forward.
Yeah, greetings, Francis, and to the viewers. Indeed, I think that we are in the different stage of the pandemic and the pandemic response in South Africa. We've really shifted from the place where we were focused on just public health prevention measures, where just focusing on behavior. We now have the tools. We've got enough capacity to provide vaccination to a large population. But what we are struggling with is in terms of how to generate demand for the vaccines. And of course, this is understandable. Sometimes it takes a while. You'll have those people who were mostly optimistic about vaccines. They are vaccinated now. That 40% represents the large group of early majority and early adopters. But then we have to now think about strategies, Francis, of how to get to the late majority and the late adopters in order to increase our vaccination coverage in South Africa.
Well, do you think they will come on board? I mean, some people say this has been rushed, but if you look at this in terms of a medical trial, billions around the world have been vaccinated. The side effects, statistically very, very low, but there's still this hesitancy. There was this idea that people would see their friends and families getting vaccinated and all would be well. Was that a false hope, do you believe?
No, I think that it's got to do with the general pattern of how information penetrates into population and the sort of time people need to make decisions. It's just unfortunate that with COVID-19, we don't have the luxury of time. And all over the world, everybody is rushing to get people vaccinated for that reason. Many of the countries that are far ahead of us, they've had a little bit more time to have sort of penetration of information, or as we call it, diffusion of the innovations that are being brought in. We've had less time, but in that time we've achieved a lot. In Africa, countries that are ahead of us is countries like Morocco and Tunisia, except for the small islands. But nevertheless, I do think that we have a duty in South Africa to think about what is it that our people need in order to get vaccinated. And this is a different issue. Most of the time, with people think that we are still, the sort of critique we give refers to the capacity. We are done with capacity. We've covered that. But really what we are focused on, Francis, is about what is it that our people need to ensure that we can reach those high levels of vaccination? And that's the demand side of things. We are not very good at it because it requires a lot of engagement on the people. I've always said that if you look at the way we engage voters on the ground, it's quite active in person, and it really mobilizes people. Those are the kind of strategies in South Africa that work for us, and we need those kind of approaches. It's not just a matter of releasing a pamphlet.
Yeah, so we failed to encourage people as government, as a society.
Absolutely. I actually think that the people that came to us are people who were going to come to us anyway. And yes, we've done quite a bit to provide that information that they will need, that even those early majority people will need. But I don't think that we have actually gone further to actually engage people at a local level in order to mobilize them. The provinces that are ahead in South Africa, that's what they're doing. Provinces like Limpopo in the Eastern Cape and Western Cape, they're engaging at the ground. So those strategies are needed in order to get the late majority group, so that we can be on par with countries that are ahead, above 60% of coverage.
Yeah. And of course, now the big debate is, do you force people, do you go for push measures or pull measures? What do you think of Austria's announcement? And some saying it'll be interesting how it really polices this. But those who are not vaccinated will not be able to leave their homes during a lockdown, except for essential goods. Those who've been vaccinated can live freely. It's an interesting way of doing a lockdown.
Yeah, no, we are indeed, Francis, following closely the situation in Europe. One, because that's the epicenter currently, but also in terms of the interventions that they are putting in place. And Austria, Germany, Netherlands, they're all very interesting in how they are approaching this. I think that the situation in Austria is unique in the sense that they are already at 67% coverage of vaccination. And so we are nowhere near that. And also, I think that they've got the infrastructure and the policing to be able to regulate this. We can't do that. I still think that their approach is pretty harsh compared to what Singapore is doing. Singapore has got 7% that is not vaccinated, but their approach is also to keep them in their homes, but they are using a different message. I think their message is more gentle. I think in Austria, it's really more about, pressuring people to get vaccinated by depriving them. I don't know if this will really work in South Africa, but when we do reach those higher percentages and the infections are still spreading, you will see our policies also adapt to those levels of vaccination. Right now, 40% is not enough to adopt such measures. It's still a large percent of the population that is not vaccinated. We need to do the basics first.
All right, finally, I mean, the weekend vaccination drives, there's a lot of hope, I think, around those. And the health minister was saying over the weekend they wanted to get to that 500,000 mark. I don't think we're near there yet, but is it making a difference that vaccinations are open for people on the weekend?
I think that it's important to do the mobilization that government is doing. It's unfortunate that the other political parties don't seem to be actively involved in this process. That's very unfortunate. However, government also only managed to achieve just over 50%, I think about 53% of the target that they aimed for, of 500,000. That's not good. It's not good enough in terms of the target. However, the numbers are larger than the numbers we saw the last weekend. So it's making a little bit of a difference, Francis. But I do think that those approaches that they're following might actually make a difference. I can see how the Vuma vaccination can push us closer to 60% of accepted vaccines if it was being done consistently. I can only hope that it can be done consistently, it can be done more at a local level, and it can include larger groups of leaders, including other political parties and religious leaders and traditional leaders.
All right, yeah, let's hope for a huge pickup by December, especially with the looming fourth wave that we often hear about. Thank you very much, Professor Mosa Moshabela from the University of KwaZulu-Natal.